In the fight against the coronavirus, our healthcare workers are putting their own lives on the front line. When we talk about this every day, they're trying to save others. According to the latest data from the CDC, more than 9,000 medical personnel have been infected with the virus, while the majority had mild symptoms. Some have, of course, died. And now a leading bioethicist is calling on Congress to create a healthcare heroes compensation fund for medical workers, similar to the September 11th Victim Compensation Fund that was finally approved for first responders after 9/11 at the Twin Towers. Joining me now is Ruth Faden, the founder of the Johns Hopkins Berman Institute of Bioethics. I think Ruth is there.
I'm here. There we go.
Okay, we're good. I'm sorry. We've had a few technical hiccups, but thanks so much for joining us, Ruth. I'm fascinated, intrigued by your proposal for a compensation relief fund for these first responders. How would it work, and what can we do to support this effort?
Well, thank you. And you're already doing it by giving us a chance to talk about it on air. I should say that the original idea, the kernel, is of course for healthcare workers, but it's only fair and appropriate that this concept be extended to all essential workers. I mean, basically, we have a significant ethics disjunct. We have some groups of people disproportionately bearing the burdens of the pandemic and also the burdens of the response. They're risking their lives. In some cases, they're losing their lives so that we can go on with our lives. That's morally just hugely problematic. So there's many things that we need to do to try, at least in part, to mitigate that imbalance. One, of course, is to give our workers the safest possible environment. And it's another conversation how we have in many instances failed in that, our essential workers. There are lots of things that we need and should be doing. But at least one of the things we need and should be doing is to recognize that it would be horribly wrong if we were to leave the families of essential workers and the essential workers themselves to handle on their own the financial burdens that do inevitably come when an essential worker becomes seriously ill with COVID, and God forbid, when an essential worker dies. So the idea here is that among the things, not the only thing, but among the things that all of the rest of us owe our essential workers is at least assistance with the financial burdens of serious disease and death. So how would this work? The ethics case, I think, is clear. The mechanics always a bit challenging, but we have a phenomenal precedent, and that's the Public Safety Officers Benefits and Educational Assistance Law. Sorry, it's a bit of a mouthful. It's been on the books for, I think, 50 years, and that law provides benefits for family members of firefighters and police who die in the line of duty, and we can pattern this fund very much on that existing federal law.
Ruth Faden, thank you so much for beginning a conversation. Let's continue it as we proceed. Such an important topic.